Hi, my name is Pooja Patel. I'm a FMP student, and I'm going to go ahead and do your physical assessment. Is that okay for you? Yeah. Okay. I wash my hand. I'm going to start with a couple of questions. Um, do you have any medical history? No. Surgical history? I've had my gallbladder removed. Okay. How long ago? 2 years ago. 2 years ago. Okay. What about your? Do you have any medication allergy or any food allergies? No. Okay. I'm also going to ask you. Do you have any headache or numbness or tingling or anything like that? No. Okay. What about like, are you having problem with breathing? No. Okay. When you walk, are you having any pain or no? Okay. Nausea, vomiting? Nope. Okay. What about, do you feel any too hot, too cold, or anything like that? No. Okay. I already grabbed my height, weight, and vital signs. Now I'm going to go ahead and start with the assessment. And I already washed my hand as well. So I'm going to start with the head, face, and skin assessment. For that, I'm just all right. So I'm going to just like checking the skin. So skin looks like good for the ethnicity. Skin also it is like warm and moist. It is like good texture. After that, I'm going to go ahead and start with the hair. So I'm going to use my hand and just like palpate the head and just to make sure like there is like no masses or anything like that, like no tenderness or anything like that. So I'm going to go ahead and palpate your head. Can you lean forward for me, please? Okay. So I'm do you feel any tenderness down here? No. Okay. All right. So I cannot see any tendon. I cannot see any lesions or masses or anything like that. Um, After that, I'm going to go ahead and do the facial nerve 7. So which is so I'm going to ask you, can you smile for me? Okay, can you show your teeth for me? All right. Can you keep your eyes closed for me? All right. Can you frown for me? You can open your eyes, yeah. Can you pop out your cheek for me? Okay, so cranial nerve 7, which is intact. After that, I'm going to go ahead and do the trigeminal nerve, which is like fifth nerve. So for that, I'm going to go ahead and check for the sensation. Just let me know when I'm touching you, okay? Do you feel the same, like a both side when I'm touching you? Yes. Okay, what about here? Yes. Okay, what about here? Yes. Okay. So, and I'm going to check for TMJ, what is the temporal mandibular joint. So I'm going to ask the patient to open and close the mouth, and just to make sure like there is like no what is called tenderness down there. So can you open and close your mouth for me? Okay. Do you feel any tenderness down here? Yeah. Can you do one more time for me? Okay. So I cannot hear any sounds and there is like no tenderness or anything like that. So trigeminal fifth nerve, which is intact as well. After that, this is my head, face, and skin. I'm going to go ahead and start with the eye. For the eye, I'm just going to inspect the eyes first, just to just make sure like what is like eyebrows like looks like, eyelashes look like, around the eyes looks like, everything like well distributed. After that, I'm going to go ahead and keep my what is called hand down here and check for the sclera, conjunctiva, lens, lacrimal apparatus. Everything looks good. Um, After that, I'm going to go ahead and check for the 3, 4, and 6 cranial nerves. So for that, that's the extraocular like so we check for the extraocular muscles movements. So can you follow my finger? Mm, okay, and so I'm checking for extraocular like muscles. So it's there is like no nystagmus present, and the accommodation test. You can see the what is called constrictions of the pupils. So I'm going to go ahead and do the what is called pupil test. So I'm going to shine the lights in your eyes. Okay, all right. I can see the constrictions. So when I shine the light, I can see the constrictions of their pupil, and at the same time, I can see the other side as well. So you can see the conceptual like response as well. So pupils are active, reactive to lights around. After that, I'm going to go ahead and do the optic nerve stacking. So for that, I'm going to take this Snellen chart and ask the patient to close one eye. Can you close one eye? And can you read the smallest line possible?
Yes. LTFPH.
Okay. Can you do the other eye now? Okay.
Um, L F. Wait. Okay. We're gonna do CPDHJ.
Okay. So one side is 2020 and other side is 2025. Can you keep eyes open and then just read it for me?
LTFPH.
Okay. Right. After that, I'm going to go ahead and what is called visual field. So can you close the opposite eye of me and just let me know like when you see me, see my fingers, okay? Yeah. Okay. Yeah. Okay. Yeah. Okay. You're gonna do other side. No. Okay. No. Okay. No. Okay. So optic now second, which is a check as well. After that, I'm going to go ahead and do ophthalmoscope examination. So I'm going to check for the what is called eyes. Okay, yeah, it's on. All right. So I can see the red light reflects. I cannot see red light, but I can see the retinal arteries, vein, over here. Um, After that, I'm going to go ahead and do the ear examination for the ear. I'm going to go ahead and check for the ear. So I'm like checking for what is called helix, antihelix, or tragus, what is called mastoid process, auricle. So I'm just like checking there is like no redness present, like no lesions present. I'm going to palpate the side. So I'm gonna go palpate. Do you feel any tenderness down here?
Mm-mm.
Okay. I'm also checking the external canal. So we check for the external canal for any kind of swelling, any kind of segment, or any kind of like drainage coming out. Like external canal looks fine. So I'm going to do the same things over here. So what is called ear looks fine. I'm going to palpate. Do you have any tenderness over here?
No.
Okay. All right. Um, After that, I'm going to go ahead and start with what is called cranial nerve 8, which is like vestibular cochlear nerve. So for that, we check for the whisper test, we do the Weber test, and we do the running test. So I'm going to whisper like once every year and ask like what I whispered. So I'm going to go ahead over here and or can you close the other ear for me? Okay, hospital. Okay. I'm going to do other side now. Sorry. Okay. So after that, I'm going to go ahead and do the what is called Weber test. For the Weber test, I'm going to strike this what is called the tuning fork and put it on the forehead and check for the lateralizations of the sounds. Okay. So I'm going to strike. Okay. Do you hear or feel anything? I hear. Okay. Do
Both
you,
sides.
okay. Do you feel the like same frequency?
Mm-hmm.
Okay. So in the Weber test, like when you strike the like when you put it over here and you feel sorry, if you hear like same sound like a both here, that means that Weber test is normal. But if it's like literalization one of the other, then you do have like sensory neural or conductive hearing loss. I'm going to go ahead and do with like now running test. So I'm going to strike and put it on the master process and now I'm going to ask the patients like when she stop like hearing that I'm going to like put it over like air sorry what is called air conduction. So Let me know when you stop. No. No. Okay. Now I'm going to do with other ear. Okay. No. No. Okay. So air conduction is greater than bond conduction. So that means that's like test is normal. After that, I'm going to go ahead and check for the also whenever like we checking for the year, we also check for anti-helix is like what is called aligned with outer canvas of the eye. So it looks like both side of the anti-helix is aligned to the outer canvas of the eye. After that, I'm going to go ahead and check for the ear. So let me take my otoscope. All right. So for the adult, we usually like pull up and back. So just let me know if I hurt you or anything like that. Okay. Right, so. All right. I can see like some sediment present over there. I can see the tympanic membrane, holly gray. I can see the light reflex. Uh, what is and I can see a mole and Melis. Okay, I'm going to check other side. So up and back. I see the same thing this side as well, like tympanic membrane is fully gray. Humble, Marius, and let's with a bit like sediment. Alright. Um, that's about for the ear. After that, I'm going to go ahead and start with the nose. For the nose, I'm like checking for the alignment, like where is the nose. And I'm gonna go ahead and palpate. So I'm going to palpate the sinuses. Just let me know if you feel any tenderness, okay? So I'm palpating over here, which is like ethmoid sinuses. Do you feel anything? Okay. And I'm gonna palpate the maxillary sinuses, which is like right over in the cheek. Do you feel anything? Okay. I'm going to do like of the frontal, so which is usually like a bow, usually like feel the pain like underneath of the eyebrow, but I'm going to feel like above and lower the eyebrow. Okay. Do you feel any tightness down here? Okay, what about you? I'm sorry, my hand's cold. Um, After that, I'm going to go ahead and check for your nose. For the nose, I'm going to use my pen light and I'm going to check like the how the septum looks like, any discharge present or not. So can you all right. So there's like no discharge. I can see the septum at the midline, and no lesions or anything like that. Okay. After that, can you just like close your one nostril and take a deep breath for me? Okay. What about other side? Okay, so pattern C is good as well. After that, for this one, we check usually like what is called olfactory nerve, cranial nerve first, so which is like intact as well. After that, I'm going to go ahead and do for the mouth and nose, sorry, mouth and oral cavity. So for that, I'm checking for the leaves. There is like no lesions or anything like that. I'm going to go ahead and check like inside of the mouth. So for that, I'm using like a tongue depressor. I'm going to ask the patients to do R. Can you do R for me? Uh-huh. Okay, so when I say so you can see the soft palate is like rising. So that is makes vagus nerve 10, which is intact. Okay, I'm going to check your buccal mucosa, which is like clean. I can't see any lesion. Okay, I'm going to check on back over here. Okay, okay, do up. Okay, okay. So um so I can see the tonsillar, I can see the there is like no tonsils. I can see the soft palate, hard palate, and buccal mucosa. which is fine too. Can you stick out your tongue for me? Okay, can you do like right and left for me? Which is like cranial nerve 12, which is like hypoglossal nerve, which is intact as well. After that, can you swallow for me? All right, so this is like glossopharyngeal nerve, which is like ninth cranial nerve, which is intact as well. And dentitions and gums like that intact as well. Uh, Watson duct and Stenson duct, I can see like bilaterally, which is like intact as well. After that, I'm going to go ahead and um, start with what is called neck. For the neck, I'm just gonna check for the neck. So check like any pulsation or any masses, like positions of the trachea, which is like looks normal as well. After that, I'm going to go ahead and ask like for some like range of motion exercise. Can you look up to the ceilings for me? All right. Can you look down to them? Okay. Can you do like side to side? Okay. So this is like flexion, extension, and then like a rotation. And can you pull your shoulder towards your ear? Okay. This is like a lateral flexion, which is intact as well. So neck is like fine range of motion. After that, I'm going to go ahead and check for the spinal accessory nerve, which is 11th, like which is I'm going to check for the what is called resistance. So I'm going to keep my hands over here. Can you push towards my hand over here? Okay. What about here? Okay. Can you shrug your shoulder? Okay. Okay. So spinal nerve 11, which is intact as well. After that, I'm going to go ahead and do the lymph node test. So for the lymph node, I'm going to go ahead and palpate the lymph node. Um, so this is over here, which is like periauricularly, you use like the head of the finger and the rotator movement. So do you feel any tenderness down here? Okay. So that is preauricular. Okay. And what about here? Okay. This is a postauricular. Okay. What about here? So this is a occipital. Okay. What about here? So this is a tonsillar. Okay. This is the submandibular. Over here is the submental. All right. So over here is the anterior cervical. Little bit behind, this is a post cervical. Over here, it is like a deep cervical, and the clavicle bone, like upper over here, it is a supraclavicular. So that is like no lymphadenopathy present. After that, I'm going to go ahead and check for the thyroid, so and the trachea. So I'm just going to go ahead and check just to inspect first. So I cannot see any lesions or any masses or anything like that. After that, can you swallow for me, please? All right. So I cannot see any thyroid gland enlargement or anything like that. So this is my neck assessment. After that, I'm going to go ahead and start with the chest. So for the chest, I'm like going to see like how she's breathing. So she's breathing fine. I'm gonna go ahead and check like anterior and posterior like AP ratio, which is like looks normal to me as well. So after that, I'm going to go ahead and do for what is called. I'm going to go start with palpation. So just let me know like if you feel any tenderness down here. Okay. 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 I'm going to go check like a backside. Okay. 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 All right. I'm going to go ahead and do the percussions over here. Right. Right. I'm going to go ahead and a little bit back over here. Okay. Backside. Mostly I can like listen, hear the what is called resonant sound. After that, I'm going to go ahead and do the auscultate. Yeah, can you take a deep breath for me? Okay, I'm going to go ahead into the back side. All right, since I'm on the bag, I'm going to go ahead and check for the symmetricals of the bag. So I'm going to go ahead and can you just take a deep breath for me? All right. So you can see like my the what is called my thumbs is like getting apart. That means like your patient is like breathing like symmetrical. Also, I'm going to go ahead and check for the what is called tactile parameters. So I'm going to ask the patient to say 99, and just to make sure like what is called sounds is like resonating like at the both area, like everywhere in the same like way. All right, can you say 99 for me?
99,
Okay.
99,
Okay.
99,
Mm-hmm.
99,
Mm-hmm.
99,
Mm-hmm.
99,
Mm-hmm.
99,
Mm-hmm.
99,
Mm-hmm. And I'm going to do the front side, same thing.
99,
Mhm,
99,
mhm,
99, 99, 99, 99.
okay. Um, After that, I'm going to go ahead and check for the CVA tenderness. Okay, just let me know if you feel any tenderness down here, okay? Okay. All right, so no tenderness noted. So that's for my chest in the what is called respiratory assessment. After that, I'm going to go ahead and start with the heart. For the heart, I'm going to go ahead and palpate, inspect the lungs, but at the same time, so I'm going to go ahead and palpate the what is called the PMI proximal. Um, so over here, so you do like a fifth intercostal space. I can feel it so many times. Like the patient, if you cannot feel anything, you can just ask them to lean it, and you can feel it. And if you cannot, like so many times, like patients like have a cardiomegaly problem, like they can have like the PMI is like a little bit like down. After that, I'm going to go ahead and what is called palpate the aortic, pulmonary, just to make sure that it's like no tenderness down here. Do you feel any tenderness down here? Okay. What about here? Okay, IoT, pulmonary, and then like the polyintercostal space over here. Okay, okay, all right. And after that, I'm going to go ahead and do the percussion as well over that side. I'm going to go ahead and do the auscultation. So, all right. I can see this and that. That's my next two. Over here, aortic, pulmonary, and I'm doing the ups. Okay, and a little bit over here, which is like mitral. Okay, here, can you see? Okay. Um, I'm going to go ahead and check for the pulse. So I'm going to go ahead and the carotid pulse. I'm gonna go. Oh, sorry, one side. Mhm. Here. Yes. The brachial. Okay. And I'm gonna do the radial pulse, the popliteal pulse down here. Can you lean up a little bit? Yeah. Okay. Can you bend it for me? Thank you. Okay. Can you take your shoes off for me? Thank you. I'm gonna go ahead and do the what is called dorsal pedestals. So I'm gonna go ahead and check down here, right? And the posterior tibial down here. Just do it. Okay. Since I'm like over here, I can check any kind of like what is called swellings or anything like that. I cannot see any swellings or edema or anything like that. I can't see any varicositis vein or anything like that. I'm going to check for the capillary refill as well. Okay. All right, please listen to a second. After that, I'm gonna go ahead and just like do for the carotid brooding. No one at a time. Okay. All right, so there's like no blurry patient. I'm going to go ahead and do the S1 and S2 with my bell. In my stethoscope, I don't have bell, but I am going to do with a light what is called um light auscultation. Okay, so mm, okay. And I'm gonna do over here, tricuspid. Yeah. Um, After that, I'm going to go ahead and start with the abdomen now. For the abdomen, can you lay down for me, please? So for the abdomens, I'm checking for the what is called I'm just like inspecting the abdomen just to make sure like there is like no lesions or anything present. That is like I'm also checking for any peristalsis like wave or anything like that. Um, I'm also like checking for like any like peristalsis like wave or anything like presence or not. So like also checking for like abdomen is like distended or not. So her abdomen looks flat. I cannot see any like strara gravidum or anything like that. It looks flat. After that, I'm going to go ahead and do with auscultation. Right, I'm gonna put this one down for a little bit. Okay. Um, I'm going to go ahead. So I'm going to go ahead and do the what is called percussions over here. All right, my hands are cold. I'm sorry. Ready? So okay, I'm going to go ahead with like a light palpation, and then I'm going to do the deep palpations. So just let me know if you feel any tenderness down here. Okay. So for light palpation, do you feel any tenderness? Okay. What about here? Okay. What about here? Okay. What about here? Okay. What about here? Okay, so no tenderness down here. I'm going to go the deep palpation. For that, just let me know if you feel any tenderness. Okay, so usually we do deep palpation just to make sure like there is like no masses or like that. Okay, how about now? Okay, what about here? Okay, what about here? Okay, what about here? Okay, what about here? Okay. I did that. Now I'm going to go ahead and what is called check for like sorry palpate the what is called liver. So I'm going to go ahead and just let me know if you feel any tenderness. Okay, so I'm going to do it right over here. Yeah, and I'm going to go ahead and do the sling. Yeah. I'm going to go ahead and do the scratch test. Yeah. Sorry. Okay, so sorry. Okay, so I'm just like the liver scratch test. So I just like what is called the edge of the liver. After that, I'm going to go ahead and do the musculoskeletal and neurological examination. You can just sit down for that. All right. So for that, I'm going to, so for the musculoskeletal and neurological examination, like you check like for any kind of involuntary movements present, like how's the posture. So when she stands up, we can see the posture, but like there is like no involuntary movements or anything like presence over here. I'm going to go ahead and what is called do the palpations, right? So I'm gonna start with the upper extremities and then I will go to the lower extremities. Do you feel any tenderness down here? Okay. What about here? Okay. What about here? Okay. What about here? Okay. I'm just like for the hip. What about here? Okay. What about here? Okay. And what about here? Okay. I'm gonna go ahead and start with the range of motion exercise. So for that, can you do like your hands like this? Okay, do up like this, or do down like this, or can you do rotate like this for me? All right. Okay, can you do up, look up and down, and right and left for me? All right, perfect. Can you bend your yeah, and okay, perfect. What about wrist? Open and close wrist for me. Okay, so I can see like range of motion is like fine for me. Okay, you can put it down. All right. Don't push, don't let me push you. Okay. All right. Can you let's say elbows for me? Okay, don't let me push you. Okay. What about here? Okay. Can you open your arms more? Okay. Don't let me close it. Okay. Okay. All right. And can you do like range of motion for me? Okay. For upper extremities, like what is called range of motions exercises. Okay. And strength is like 5 by 5 bilateral upper extremities. For the lower extremities, can you like flex and like straighten out your knees for me, please? Okay. All right. All right. Can you do like this? All right. Can you do up and down toes for me? Okay. Can you do inversion and eversion for me, like all in and out? Okay. All right, perfect. Okay. After that, I'm going to go ahead. Can you sit down for me? Okay. So don't let me push you. Okay. So what about over here? Okay. What about here? Okay. Over here. Okay. Over here. Okay. Up. Okay. Okay. All right, so strength looks good over here. After that, I'm going to go ahead and what is called check for the sensation. So I'm going to so whenever I touch you, just let me know like if you feel like sharp or dull pain. Okay. So this is dull and this is sharp. Okay. All right. So what about this? Dull. Okay. Dull. Okay. Dull. Sure. And this is dull and this is sharp. Okay. Dull. Sharp. Sharp. Dull. Sharp. Yes. So sensory that's intact as well. I'm going to go ahead and start with the fine motor skill. So can you touch your what is called thumb to finger like this? Okay, perfect. And can you flap? Okay, perfect. And after that, can you the opposite side of the leg? Can you do shin to heel like this? Okay. Other side. Okay, so fine motor skills intact as well. After that, I'm going to go ahead and do the dip tendon reflexes. For that, I'm going to do the brachial, sorry, biceps reflex, triceps reflex, brachioradial, ischius, and patella. So I'm going to go ahead and so and so you can see the contractions of the biceps over here, the same. Okay. All right. I'm going to go ahead and do the triceps over here. So for that, you can see over here the contraction of the triceps. Okay. All right. I'm going to go ahead and you can just like click normal, and I'm going to go ahead and check for the brachioradial. Okay. Okay. I'm gonna go ahead and check for the patellar reflex. For that, I'm gonna go ahead and put my hands down here. Can you close your eyes for me? Okay. Okay. I'm going to go ahead and do the what is called Achilles reflex. So for that, I'm gonna hold like this, bit like this, and okay. Okay. So you can see the plantar like flexion, which is normal. Okay. All right. After that, I'm going to go ahead and do the Rombach test. Can you stand up for me, please? All right. Can you close your eyes for me? Okay. So usually like you just like stay like beside the patient just to make sure like if patients like lose the balance or anything like that. Okay, you can open your eyes for me. So Rombach test is like negative. After that, I'm going to ask like, can you just like walk straight for me? Normal. All right. Now can you walk on your toes for me? Okay. Now can you walk on your heel for me? Can you walk like you're walking on a string, like one, yeah, okay. All right, perfect. Right, thank you. After that, I'm going to go ahead and check for the back, for the spine. So then the patient is kind of like just to make sure like the spine looks fine. I'm going to go ahead and palpate just to make sure. Just let me know if you have any tenderness. Okay. Can you lean backward and touch your toes for me? So I'm like checking the spine. It looks fine. After that, can you you can okay. Now can you do like side to side? Okay, can you do like flex and like extension? Uh-huh. All right. Can you like rotate your spine like this? Okay. All right. So spine like looks normal. There is like no abnormalities or anything like that. You can sit down. All right, so I just like finished the physical examinations over here. For my education, I would just like say, she looks like healthy. So I'm just like do the preventative visit like as you are doing and continue like doing like regular exercise and meal like properly. Okay, thank you so much.